Hello everyone. Most of us, I think, will breathe a sigh of relief with the approach of a new year and the end of what for most of us has been a very difficult 2020. Of course, it's not over yet, and unfortunately, we now see the definite start of a third wave, which is going to take us into the new year. The year has been challenging in so many ways. At the start of the year, most of us would only have ever heard the word pandemic at the movies, and now we're all familiar with a whole new vocabulary from the world of virology. Whereas normally at this time of the year, we reach out to friends and relatives. To do so now would risk you becoming a social outcast. We've become used to going about our daily lives, barely recognisable under a face mask. We've all struggled with the idea of maintaining protective distancing. We're not known as a country of individuals, but rather for the collective warmth of our welcome. And yet many of us have had to adjust to life in relative isolation from others and of course working from home. As expected, we're now seeing the health effects of this in terms of psychological ill health. Like many of you, we at Cognate Health have also changed how we go about our business and have quickly moved to provide most of our consultations by video and by telephone, while also offering face-to-face COVID-safe consultations. We've built in remote services such as our Day 1 Plus remote case management service. And the challenges that we ourselves have faced mirror the challenges faced by our clients, and therefore we fully understand the complexities of the new workplace. Our clinics have been fully operational throughout the year, and we see firsthand the health effects arising from the pandemic. We think we're uniquely placed then to advise you how these can be managed and prevented. One of the aspects of the pandemic, I think, that has been particularly challenging has been the existence of so much changing information. Everyday media sources are full of scientific detail, usually confined to scientific journals. It can make the head spin, and unfortunately this results in a feeling of confusion and fear. As an example, look at the information on travel, how much this has changed over the past few days. In fact, it changes on a daily basis now. And the weekend just passed has again emphasised that nothing stays the same for long with this virus. And yet, like all respiratory viruses, the main means of protection from harm are still individual measures such as good cough and respiratory etiquette, good hand hygiene, avoiding touching the face and avoiding shaking hands. These are combined with collective measures, or what I refer to as protective distancing. This comprises physical distancing and social distancing, or avoiding crowds. Oh and yes, masks do work. It may well be something that we adopt into the future at different times. Early identification of cases with isolation and rigorous contact tracing is still a fundamental prevention and control measure. If we all diligently apply individual and collective measures, it's likely we could avoid lockdowns. I'm afraid that a chain is only as strong as its weakest link. I think it's important to remember that most people get better and simple methods of protection work. And by the way, getting the vaccine will not mean that we can drop any of these measures, really until such time as herd immunity has been achieved or our national expert groups tell us that it's okay. It's also predictable that a new variant has been identified, which has resulted in so much transport difficulty over the last few days. But this is what viruses do to survive. I think on a positive note, over 2 million people now have been vaccinated in what will be the biggest vaccination campaign ever. All these initial studies indicate that these vaccines are both safe and effective, not just for the general population, but also for at-risk groups. The national protocol was released last week and outlines how the programme will be rolled out, beginning with those at highest risk. The aim will be to have a sense of normality again by the autumn, so that we are prepared for the next winter. In finishing, I think one piece of advice I'd give you over the holidays is to try to get away from the media and the flood of information for a while. The constant bombardment of information, some of it good, but a lot of it not so good, can result in information overload and stress. The last time I gave this advice to people was at the beginning of the crash, and it was effective then. Instead, I'd encourage you to get out and about, avail of fresh air and sunshine, try to switch off from the daily worries, take advantage of the benefits of time for yourself. When you worry, try to reframe and focus on the next 6 months and I believe we will have a substantial change in the dynamic of our fight with the virus, and we should have prevailed as we head into late summer. While you're taking a break, we'll be working on putting together some FAQs for you about the virus and the vaccines, and also an update on the guidance as to how it stands at the beginning of 2021. This information will be available on our website and will give you an expert overview. In the meantime, do have a happy holiday.